Canadian healthcare workers are warning that protocols and guidelines in place at hospitals are putting them and their patients at risk. Their federal union is urging the Minister of Health to reconsider those guidelines to mirror what's happening here at Ontario hospitals, something that the Public Health Agency of Canada says it's now considering. Their precautions outlined by the Public Health Agency of Canada that Canadian Federation of Nurses unions say are not good enough.
They do not protect healthcare workers across the country. In comparison to Ontario, they're very much more alert and scientifically based to protect our workers.
The standards, which were upgraded last week, lay out precautions healthcare workers should take through the duration of an outbreak. According to the nurses union right now nationwide, that only includes wearing the N95 face mask. The president of the labor organization argues that is inadequate, saying because of the uncertainty surrounding the spread of the COVID-19 coronavirus, greater measures should be taken.
We have to make sure when the science is not clear, and in this virus, the science is not clear how it's going to be transmitted. Is it contact, droplets, or airborne? We have to make sure that the healthcare workers, nurses, doctors, everyone are well protected if a patient comes in.
The union has reached out to the Minister of Health with their concerns, urging officials should reconsider its current national guidelines. The Public Health Agency of Canada says this guidance was developed with the advice of the National Advisory Committee on Infection Prevention Control, including a committee of experts in infectious disease and other related departments. They say the guideline was then reviewed and approved by federal, provincial, territorial special advisory committees.
This goes further than a public health emergency. It goes to the core of our healthcare sector. If our nurses, our doctors, our healthcare workers are not well protected, the public is not well protected.
In a statement to CityNews, Public Health says in part, discussions with the CFNU and other association and comments received are being considered and will be discussed with federal, provincial, and territorial special advisory committees as part of the process to update interim guidance.
The Public Health Agency of Canada has a great mandate to protect the public, and they're doing that very well. But for healthcare workers, they're failing. So either correct your message or get out of that topic completely.
Now, while Ontario does have its own protocols in place, nationally, other provinces are relying heavily on the federal recommendations. Now, while Public Health has said that they will be reviewing these guidelines, they haven't actually said as to when that will happen.